Do SLPs have a role with assessment and treatment of ARFID? ASHA recently came out with a great article on ARFID versus PFD and the SLP role. Let's get into it. PFD stands for Pediatric Feeding Disorder, which is characterized by dysfunction in medical, nutritional, feeding skill, and/or psychosocial domains. It can be diagnosed and treated by speech-language pathologists, with frequent collaboration as part of an interdisciplinary team. This might include GIs, ENTs, dietitians, PTs, OTs, etc. ARFID stands for Avoidant Restrictive Food Intake Disorder. This is an eating disorder unrelated to body image, but may be characterized by sensory sensitivities, low interest in food, or fear of negative consequences associated with eating, such as choking or vomiting. ARFID is diagnosed by a mental health professional or physician, and primary care is typically managed by a mental health professional, though often part of an interdisciplinary team as well. ARFID and PFD can coexist, and I want to make this really clear. SLPs may play a role in the treatment of patients with ARFID if there is an overlap with PFD. This might look like assessing to rule out PFD, diagnosing PFD, even with a current ARFID diagnosis, making appropriate referrals, targeting feeding skills if they coexist, offering strategies to promote more positive meal times, collaborating with caregivers and mental health professionals, and knowing when to step away when it's no longer in our scope. This last one is especially important because SLPs do not treat ARFID. Yes, you heard that right. SLPs do not treat ARFID. This is a mental health diagnosis, and it's important that patients see the most appropriate provider for treatment. I know this can be hard, especially when there may be a lack of pediatric mental health providers in your area, but this doesn't mean we can just treat outside of our scope. You wouldn't just start treating cardiac conditions just because a pediatric cardiologist isn't available in your area. Okay, extreme example, but you get the point. Consider using this article to help families understand what the SLP role actually entails, and check out the caption for a few more thoughts I have.